Good morning, everybody. Happy Monday. Thank you so much for joining us for our press conference to discuss, more accountability and transparency over who will be vaccinating immigrants and people inside private immigrant detention facilities. My name is Monica Lee. I'm with the California Pan-Ethnic Health Network, just helping to moderate, helping to, do that today. So again, thank you. You're all on mute. We will have a segment after all of our speakers are done for question and answer. You can either drop your questions in the chat or during the Q&A segment, you can ask to be unmuted and we on our end will unmute you and so you can ask your question. And we will be recording today's event. So if you'd like to rewatch it or we'll be sharing it as well with maybe some of your colleagues who weren't able to join us this morning. But again, thank you so much. And again, the opportunities for questions will be later. But I would like to introduce our first speaker. We have Assembly Member and Dr. Joaquin Arambula representing the Fresno area, and he will be our first speaker. So off to you, Dr. Arambula. Thank you.
Thank you, Monica and CPEN, for helping to put on this press conference. The COVID-19 pandemic and the subsequent vaccine rollout have underscored issues of equity, access, and justice in California. One of the most vulnerable populations from a public health perspective are immigrants who are held against their will in immigration detention facilities. This situation is made worse given the fact that almost all immigrants in detention in California are held in private, for-profit detention facilities. Private detention facilities have been the scene of some of the largest and most preventable COVID-19 outbreaks in California. This uncontrolled spread of the virus in these facilities not only threatens those detained as well as staff, but can drain medical resources in surrounding communities and hospitals as well. During a pandemic in which the actions of a few can impact the well-being of so many, accountability for private prison operators is paramount. The humanitarian crisis posed by the spread of COVID-19 in immigration detention facilities in California has had disastrous consequences for those detained in these facilities, as well as neighboring communities. While immigrant detention facilities are under the control of the federal government, there are clear requirements for the operation of these facilities, which include requirements to coordinate with and abide by state and local public health orders. Despite these requirements, private detention operators have consistently failed to meet these standards. To make matters worse, ICE has not only failed to exercise any meaningful oversight over these facilities, but it has gone on record as explicitly stating that it would not provide COVID-19 vaccines to immigrants in detention. The American Medical Association has recently adopted a policy in support of improved health measures of prioritizing vaccine access to vulnerable individuals in immigrant detention. The policy notes, recognizing that detention center and correctional workers, incarcerated people, and detained immigrants are at high risk for COVID-19, the new policy also makes clear that these individuals should be prioritized in receiving access to safe, effective COVID-19 vaccines in the initial phases of distribution. It is also clear that individuals in detention harbor serious fears and mistrust towards detention operators, and as a result, may not feel safe accepting vaccines from these operators. Given these serious challenges around trust towards detention operators, it is clear that the public health officials and the community can play a vital role with respect to how vaccinations and information are presented and shared with individuals inside these facilities. California did the right thing by providing individuals in these facilities access to the COVID-19 vaccine, but it can still do more by ensuring that health and safety laws, including public health orders, are followed in these facilities. I have a bill right now, AB 263, that is focused on ensuring that these facilities follow public health orders as well as Cal OSHA requirements. California is a leader in terms of ensuring that immigrants have the same rights as other residents of our state. We can and must continue to play this role by expanding on our work related to protecting health and safety. We have both the legal right to do this and the moral authority. Thank you for having me today.
Thank you so much, Dr. Rambula. We really appreciate, and we know many advocates in the space. You've always been pushing for health equity, for immigrant rights, and with COVID and the pandemic, we've seen squarely the intersection really of those two really, really important things. So thank you so much for your time. Now I would like to introduce our next speaker, Jackie Gonzalez, Policy Director of Immigrant Defense Advocates, to talk a little bit more about the issue.
Thank you, Monica. Thank you to everyone joining today, and to you, Dr. Arambula, for your unwavering leadership on immigrants' rights, and specifically now on public health as we enter year 2 of this pandemic, and your important attention to this population. So as many of you may recall, last December, we were all celebrated the unveiling finally of a vaccine. And at the same time, the state of California put out its plan for vaccination and created the Community Vaccine Advisory Committee, short name CVAC, which was really tasked with ensuring that the rollout of the vaccine in our state was done in a just and equitable manner. And when we saw, as immigrant rights advocates, the state's plan, we noted and were happy to see prioritization given to vulnerable populations, and especially folks in congregate settings like nursing homes, prisons, and at the time, what was defined as detention centers. Now, we had some cause for concern as advocates because time and time again, we sort of see the immigrant detention population be left aside. And so when that plan was put out, we began to ask questions about whether the state contemplated including immigrant detention centers. And unfortunately, our biggest fears were confirmed. Our response from the state for a very long time was that they were unsure. And the reason that we were concerned is not because the state has not consistently played a role protecting this population, but because, as Dr. Arambula mentioned, these facilities are operated by private corporations. So California, just to provide some background, has at present 7 facilities that house immigrants in the state. We have one of the highest populations and bed capacity in the entire country, despite our progressive values. And those 6 out of the 7 are privately operated and have been the scene, as Dr. Arambula noted, of horrible outbreaks. And because they're privately operated and contract directly with the federal government, many local and state officials who have not been educated on the subject believe that there's very little that can be done, when in fact, there's quite a lot that can be done. So we were concerned that yet again on this vaccine issue, there would be confusion, which would cause delay. And that's in fact what happened. We were also concerned that because there would be a new president and a new administration, there would be delay in prioritizing this population. Understandably, there's a lot of horrific work to undo and lots on the new administration's plate, obviously. And what we saw in subsequent months, essentially from January to March, was as advocates pushed the Community Vaccine Advisory Committee to clarify the state's plans and where this population would fall, the federal government simultaneously had no plan. And so report after report came out, and the federal government and the state government essentially played a game of hot potato, saying that one would be responsible and the other one, asking reporters to call the state. There may be reporters listening in today who covered these stories. And after many months, I think we're really happy to say that in March, the California Department of Public Health finally, after many letters from advocates, call-ins, public comment, did ask or did clarify what we asked, which was to say that immigrants would in fact be included in the state's plan and that our vaccines would be made available in these facilities. So at the same time that happened, nationwide, there was an article that came out and say, you know, we are lucky to be in the state of California, and I think lucky to have leaders that you know, from my perspective, maybe took longer than I would have liked to see, but we're still ahead of where many other folks are in the nation. And the three things that we asked CVAC during the campaign was, of course, to include immigrants, and second, to issue public guidance to public health departments so that we could act swiftly and in a uniform manner across facilities. We wanted folks to sort of be, you know, offered the vaccine at the same time. And finally, to ensure that access to this vaccine for the population was done by a trusted medical provider and in a language that they could understand. So we've reached the first sort of goal and ask, which is immigrants are being included. But what we're seeing now is essentially a patchwork sort of rollout because the state has not responded to the two other issues, right? One is to really have a consistent plan across these local public health departments, and to really ensure that folks in detention are getting the vaccine from a trusted medical source. And I think, you know, for me, the issue of vaccine access is one I feel really passionately about. I think for so many people on this panel who work with or have provided services to folks in detention, it's really horrible to think that they have been unnecessarily civilly detained in these facilities during a pandemic, and that when we finally have access to mitigate the spread of that disease and to protect lives, that we dragged our feet for as long as we did. And, you know, the day that California announced that it would include immigrant detention centers in its plan, a gentleman, we learned that a gentleman who was released from the Adelanto detention facility, essentially to die from COVID, what was not given access to this vaccine. And you know, you have to wonder. We don't know if he would have taken it, but I think the right position to have had is that he should have had the choice. And that's our position. We do not want to see detention increase as a result of the vaccine. That's a false choice that I believe other panelists will speak to today. But the truth is that while people are detained against their will in these civil detention facilities, they should have the right to access this vaccine. And so our asks, you know, continue to be that. I want to, before I hand it over to my colleagues, really take a moment to thank so many of the partners in this advocacy, from legislators like Dr. Arambula and dozens other that signed on to a letter to push the administration, as well as our partners who you'll be hearing from today, Edwin at CCIJ, who provide legal services in these facilities, but have really stepped in and taken leadership to pilot a project so that individuals who can't access trusted medical advice can speak to doctors. And we'll hear from one of those doctors today who's also been providing consultations. And it's a laudable effort, but I must say that it's a gargantuan effort that shouldn't fall to advocates alone. And so we hope that this press conference and the information you received today is an inspiration to other states to follow our lead, to do so quickly, and to really ask that local public health departments continue to partner with us, that state officials provide more clear guidance, and that we can ensure that this vaccine rollout is truly just and equitable, not just for residents in this, you know, in the state, but those that unfortunately remain in these detention centers. So I appreciate the time and look forward to hearing from all of the other panelists. Thank you.
Thank you so much, Jackie, for setting up a little more information and background about the detention centers and what we're asking and where the gaps are. And as she mentioned, I'd like to now pass it over to Edwin Carmona Cruz. He is the Director of Community Engagement with the California Collaborative for Immigrant Justice, and we'll be speaking about, you know, what community groups are seeing on the ground and sharing, you know, their stories and how they've stepped up time and time again.
Thank you so much, Monica, and thank you, Dr. Arambula and Jackie and Dr. Turner Lloveras for being here today, and all of the advocates that are here on the line. I wanted to start off by setting up the landscape for you in terms of what we're seeing in immigrant detention. 5+ COVID-19 related deaths this fiscal year, starting on Vargas, who Jackie briefly touched upon, that passed away a couple weeks ago at the Adelanto detention facility, as well as the first COVID-19 related death of Mr. Carlos Ernesto Escobar Mejia at the Otay Mesa Detention Center. Expired and spoiled food, terrible and unsanitary conditions that compromise health, including the use of HDQ neutral that the Environmental Protection Agency recently said is in violation of federal law. This is just a fraction of the headlines and also the violence inflicted on immigrants in detention in California and numerous across the country. And knowing what we know about ICE and for-profit corporations such as GEO Group, Core Civic, and other carceral settings and their treatment of immigrants, how is it that the state of California is relying on these same actors to provide accurate, trustworthy, and culturally competent information on a life-saving vaccine? This relationship has been tainted from the root, and therefore those jailing our members of our community should not be the primary contact of information. Enrique Cristobal, who's detained at the Golden State Annex in McFarland, said, "They don't give us enough information to decide to take it or not to take it. I see that people are not taking it because of that. They, ICE and GEO, are not responsible. They're not ethical, and they keep putting our lives at risk." Not just misinformation is not the only issue at stake. Immigrants in detention and advocates, again, warn that ICE may be using vaccination as a justification for prolonged or expanded detention, arguing that those that receive the vaccine should not be considered for release. This false dichotomy must be challenged and categorically rejected. ICE must not be allowed to force those detained to choose between receiving a life-saving vaccine or forfeiting their legal case for release. Only when asked questions and moved outside of this false dichotomy are we able to really achieve some level of justice for immigrants. Nothing ever got done by feeding into the options that ICE is placing for advocates, community members, and also elected officials. Javier Vasquez, detained at the Yuba County Jail, said, "Granted, the COVID-19 vaccine is safe. The majority of us welcome the vaccine, but all of us are concerned because being vaccinated seems to threaten the likelihood of us being released during this pandemic. Our chances will be, if not reduced, taken away from being released from these confined living quarters. We feel we're made to choose between getting life-saving vaccine or keeping our chances of freedom. We hope that this vaccine doesn't permit the repopulation of detention centers that have proven to be deadly time and time again." While CCIJ engages with immigrants who are detained in these immigrant detention facilities across the state, it was through these conversations that served as the genesis of the vaccine education and empowerment in detention pilot program. We are bringing trusted healthcare providers, who you'll hear after this speech, that are answering questions with respect to the vaccine Monday through Thursday from 11 a.m. to 1 p.m. Healthcare providers are also providing a second and often the first opinion on a potential inoculation side effects as it relates to underlying medical conditions. This pilot is only temporary, and the vaccine rollout is a great example of the need of state public health officials to intervene and provide information that they're already providing to the public, be it social media, billboards, other volunteers in the community, and also television. I want to leave you with this quote from Elodio Valencia, who's detained at the Mesa Verde detention facility in Bakersfield. And he said, and I'll say it in Spanish and I'll translate it in English: "Se debe tomar en cuenta que la vacuna ayuda a una liberación segura. Me permitiría regresar con seguridad a mi familia y comunidad sin el riesgo de exponer a otros con COVID-19. El juez, ICE y GEO deberían verlo de esa manera. The vaccine should be taken into consideration as helping for a safe release. It would allow me to safely return to my family and community without the risk of spreading COVID-19. The judge, ICE, and GEO group should see it that way." Thank you so much.
Thank you so much, Edwin, again, for talking about what community groups, how they're stepping up, how they're filling in the gaps. And as you mentioned, there's already, a very wide, statewide campaign. And, those are resources, those are materials, those are things that really do need to be making it into these private detention facilities. And so I'd like to introduce our last speaker, Dr. Daniel Turner Lloveras, founding member of the Latino Coalition Against COVID-19, who has been engaging in conversations with and answering questions of people who are detained. And so I'd like to pass it over to him now. You're muted, Dr. Turner.
I still do that at every Zoom. I just want to take a moment to thank everybody for the work that they've been doing in this pilot. I think it's critical. Not only Latino population in general, since they have been disproportionately affected by COVID-19, but in particular those in detention, because we know that mistrust has fueled the vaccine hesitancy problem that we're seeing throughout the country, and of any group that has maybe suffered the most under the care of ICE detention centers. I would say those in the detention centers have suffered the most. And so we really need to have a systematic outreach program to address this medical mistrust. Otherwise, not only they, but the entire country is in danger, as any hotspot contributes to the spread of COVID-19. We know that the pandemic has exposed dangerous conditions in which detained immigrants are being held. It has devastated asylum seekers in these detention centers. America's prisons, jails, and detention centers have been among the nation's most dangerous places when it comes to infections from coronavirus. Over the past year, New York Times reported more than 1,400 new inmate infections and 7 deaths on average reported in those facilities each day. Outbreaks have overwhelmed many of these facilities, infecting everyone, and slow vaccinations and the threat of variants really leaves an uncertain landscape as we're moving forward and rolling out our vaccines and trying to stop this pandemic. For example, at an immigration detention center in Farmville, nearly every detainee, 339, were infected. In order to prevent further outbreaks, several provisions are necessary to improve adherence to the CDC public health guidance and healthcare access. But most importantly, is the COVID-19 vaccine distribution and building confidence in these vaccines so that they don't get wasted, but instead are injected into arms. And because vaccines don't save lives, those who have been vaccinated save lives. According to a recent study by UC Davis, immigrants detained in ICE detention facilities are at greater risk of contracting COVID-19 due to underlying health conditions. So in a survey of 529 individuals detained by ICE that participated in the study, 42% had at least one chronic health condition and 20% experienced a disruption in their healthcare. So the first call that I had really clearly explained the major issues that are going on right now within detention centers, and how unless we take action, this pilot is spread throughout the country into other detention centers, the vaccine rollout will not be effective in these places. When I spoke with one of those who were detained, he quickly explained to me the medical mistrust that he had and the reasons for why he had it. He talked about abuse that he had suffered. And we're working on a project where we're addressing vaccine hesitancy in the general Latino population, and we're trying to address the medical mistrust. But I mean, the mistrust in the detention centers is runs so deep and is so severe that to think that it will address itself on its own, or we won't be able to overcome this without the help of trusted community members, is really it's ludicrous. We have to really try to have a plan where we are able to have an open conversation. And the conversation is not built mainly just to convince, since most people are aware if you're trying to convince them of something. But really it's to create an inclusive open space where people can ask questions, where they can address their concerns, and someone who is not directly related in overseeing them, or perhaps maybe even had abused them in the past, is answering those questions. And so even last week, the Department of Homeland Security's internal watchdog agency released a report that shed new light on dangerous conditions at the La Palma Correctional Center. Here they confirmed the dangerous use of force, abuse, and lack of medical care as COVID-19 swept through the facility and revealed troubling details about ICE's mismanagement of detention during the pandemic. And so with reports such as this from trusted sources, we already know that there is, I wouldn't understand why someone would not have mistrust in this vaccine if they're in a detention center. So that should be just a given. And with that given, we have to outreach, we have to answer questions, and we have to share with them at the detention center, this is a vaccine for the people who are living here in this country and who deserve a chance to survive this pandemic. False information, has been influencing people already facing other hurdles to get vaccinated. And so with hurdles upon hurdles, answering them and watching them as they prevent people from getting vaccinated. We need culturally and linguistically competent care. We know that makes a difference. Numerous studies have shown that. So we must try our best to counteract this misinformation by educating our patients in a way that they're going to understand in a culturally and linguistically appropriate patient-centered fashion. In the Latino community, we normally work with churches, businesses, community health centers, but in detention centers, those resources are not available. And so we have to build these churches, we have to build these community centers, we have to build these, and the way we build them is the way we're working with this pilot is through direct outreach and through connecting those in detention with someone that they trust, that's someone that speaks their language, that someone is able to answer their questions in a way that makes them feel comfortable about the vaccine and allows them to make an informed decision on whether they think it would be to their benefit to receive it or not. We have to ensure everyone has access to independent medical experts and aren't forced to rely on ICE or private subcontractors for vaccine information. We need more direct involvement from the state and local public health officials as well in this vaccination rollout and health oversight in the private detention facilities. Leaving vaccine implementation prioritization to state decision also jeopardizes the health of micro-detention center employees, given their close proximity to detainees. We believe that an effective COVID-19 immunization strategy should also immunize employees as well as detainees, according to the CDC guidelines recommendations for vaccinations. The federal government has repeatedly refused to improve living conditions and provide needed medical care to migrants in federal facilities. This is denying fundamental human rights. But now with the new president and with new energy and with new organizations, like the Pan-Ethnic Health Network, California Collaborative for Immigrant Justice, Immigrant Defense Advocates, with these trusted community members, community groups, we can build a bridge to where we can get everyone vaccinated, which is to the advantage of everyone living in this country to keep us all safe, get us to herd immunity, and start getting back to normal.
Thank you so much, Dr. Turner-Lloveras. I would like to mention we do, Dr. Rambula does have a budget hearing. So again, thank you so much for your time, Dr. Ham. You can either email me, I'll share my information, or you can contact his communication staff directly. I'm sure you have the contact information, but thank you again, Dr. Rambula, so much for joining us today. And then we will now segue over to Q&A. I did see a few questions in the chat, so I will read those out for our panelists. Again, if you do have any questions, you can raise your hand virtually on Zoom to ask to unmute, and my colleague Aviva will unmute you as those questions come in. And you can also drop your questions in the chat. So I will pop over to the chat now. Okay, we have a question from Araceli Martinez, reporter with LA Opinion. Any idea when they're going to start vaccinating immigrants in detention centers and what the process is going to be? Any information is appreciated. Thanks.
Edwin, do you want to take that?
Sure, I'll take it. Thank you, Araceli. Yes, I mean, the vaccine rollout, as Jackie mentioned in the chat, began in mid-March. And so it really depends across the state of where vaccination rollout has begun. This pilot program has been implemented in 3 facilities in California, the Yuba County Jail, Mesa Verde Detention Facility, and the Golden State Annex, which is in McFarland. So we are, again, gauging and assessing, working with trusted healthcare providers such as Dr. Turner, Yerveras, in other parts of the state, so hopefully be able to provide the same access and information to other folks in other facilities, whether it's in Southern California and then at the border. Yeah, I hope that answers your question.
Thank you. And then our next question from Lillian Alonso. What are some efforts that are taking place for advocacy groups to support, and are there any future efforts?
Like I mentioned, this was a 3-week pilot program, and it was well received in by folks inside detention. And so we are currently in conversations of expanding this pilot with hopefully down at Imperial, and then hopefully also in Adelanto. I just saw Araceli. Yes. Araceli mentioned something about Adelanto, but there will be hopefully some action items and other calls to action to ascend to that challenge to support folks in detention. So hopefully we'll have more information about that. But again, we're making sure that that we have something that it's organized, something that is also not that is temporary, but also establishes some sort of foundation for the state and other partners to take lead locally, whatever makes sense. We always defer to our local partners on that approach.
I think I would just add, earlier in the campaign, we were really engaging individuals to make public comment to the state, to really raise their voices, to draw attention to the issue. And now that the vaccine rollout is happening, I really wanted to just go back to the last sort of statement that Edwin shared from someone inside the facility, which is that the vaccine really should be viewed as a mechanism for safe release. So to the extent that people want to get involved in advocacy, while we don't have a clear sort of opportunity at this moment for the vaccine, unless you're a medical provider, and of course we would love your volunteerism for this pilot and its expansion. One of the things that you can do as a community member is obviously to support release efforts. And I think that the more people that are vaccinated and that can safely be released into the community, sometimes those people obviously, for those that don't have family or friends, obviously need help with placements and housing, and anyone leaving detention, even with family and friends, need all levels of support. And there's so many organizations on the ground near all of the detention facilities in the state providing those critical services. So we can certainly, for those of you who might be interested, if you follow up with Monica and you share where you're at, we could definitely connect you to more local groups to see how you can support their efforts.
Thank you, Jackie and Edwin. Our next question comes from Megan. How many immigrants in California detention centers have been vaccinated so far, and how many have been offered the vaccine?
Yeah, thank you. So I'm only going to speak to the 3 facilities that we've launched this pilot in. Again, it's the Yuba County Jail, Mesa Verde, the detention facility, and McFarland, the Golden State Annex, I'm sorry. So far, everyone in these 3 facilities have been offered the vaccine. It looks like folks at Yuba all have been vaccinated, and then there's certain amount of percentages of folks at Mesa Verde and the Golden State Annex that have rejected the vaccine, given what we've talked about, the mistrust, the awful conditions, the lack of information. All of that is contributing to folks rejecting, or at least right now saying, I don't want to get the vaccine. And so one thing that we are, an issue that we are facing is, and most of you may or may not know, but every vial of the vaccine has 5 doses. And so if 2 or 3 people are like, yes, I've talked to a medical professional or a healthcare provider, and I'm ready to take the vaccine, they have to put their name on a list. And so they can't open a vial unless 5 people say yes, and then now can move forward to getting vaccinated. So no vaccine goes to waste. But again, that goes into these issues that should the state have been been intervened from the beginning and provided this information as advocates and as other organizers were calling the state to do from the beginning, we wouldn't be running into this issue right now, or at least to the point where it's all over the place. So like I said, we are talking to our local partners that are located at other facilities to figure out what that rollout looks like, and then how we can support in the meantime while the state drafts a plan and implements a plan for education and empowerment.
Thank you. And then our next question comes from Ben. Is there an ask that CDC work to provide vaccines directly to detention facilities?
The ask has not been made that CDC provide vaccines directly to facilities, at least not that I'm aware of. Our advocacy has really focused on asking the state to clarify that California's sort of vaccine pool will be made available to this population. And because the way that the vaccine has been distributed in our state has been at the county health department level, our ask has been, that guidance be made clear so that public health departments where these facilities are located can feel empowered, to have a plan for how to deal with the facilities. Nationwide, I'm not aware about whether there has been that ask, perhaps in states with sort of less friendly state governments for this population. But yeah, I don't know if any other panelists have more to share.
Thanks, Jackie. Again, if you have questions, feel free to ask them in the chat. You can also virtually raise your hand. Oh, we have another one from Megan. Okay, let's see. Do you know the number of immigrants that have been vaccinated at detention centers and or offered the vaccine? You said it was all 3 centers.
Yeah, as I mentioned before, I don't know the number across the state, but I do know, for example, there are currently 11 people at the Yuba County Jail, and there are lower numbers that we've seen, in our history at Mesa Verde and the Golden State Annex. I don't have those numbers, but I'm happy to follow up with you. Oh, thank you to my incredible colleague who saved the day. There are 36 people at Mesa Verde, in which, again, a third have denied or had said no, that they don't want the vaccine. And at Golden State Annex, we're also figuring out how many folks there have denied or have taken the vaccine.
But to the other part of Megan's question, there's seven facilities that we mentioned in the state of California with a potential capacity to hold over 7,000 immigrants. And unlike, it's important to know that number really is sort of higher in terms of the volume of people that cycle through, because unlike prisons, the majority of people do not necessarily remain in those facilities long-term, right? They're civilly detained, so they're not serving a prescribed sentence that is for a set amount of time. So we see like thousands more cycle through. During the pandemic, the number of folks, and nobody has a perfect estimate, but thanks to really amazing litigation efforts by civil rights organizations, as well as a lot of advocacy on the ground by local organizing groups, we've seen a lot of folks be released. So the actual population in the 7 facilities across the state is somewhere estimated to be about 1,500 to 2,000 individuals. And like Edwin mentioned earlier, we're really hoping to not see those centers be repopulated, but unfortunately, as long as they're operated by private prison corporations who work together with ICE, there's definitely a for-profit motive for that to happen. And again, we don't think that giving access to the vaccines is a motivating factor for that. We think that we need to try to provide and have as many people continue to be released as possible.
Thanks. There was a lot of focus on the outbreaks within CDCR prisons throughout the pandemic. Jackie just spoke a bit about the difference in ICE detention. In general, do you think there has been a lack of focus on ICE detention versus prisons and jails?
I can start, but I'm happy to have others fill in. I think there's definitely been a focus by immigrant rights advocates on this population all through last year. So many statements were put out by detainees who went on hunger strikes, who organized really at unprecedented levels to draw attention to their plight. And I'd say was a decent amount of coverage, but so many competing interests. We tried really hard, for example, at the state. The state had a hearing on private prisons and the outbreak at CDCR, and immigration detention was a footnote, which for me is appalling. And again, what I said in my earlier comments, that this population is so often invisible. And of course, people in congregate settings and in prisons run the same sort of risk, right, of contracting COVID as folks in these ICE detention facilities, but there's someone clearly responsible for their safety. And in California, that's CDCR. And what happens to immigrants in private detention facilities is, again, because of this setup where they're in these private facilities contracting directly with the federal government, which up until a few months ago was the Trump administration, it really leaves people in an, I would argue, worse position than people in prisons, because for advocates and for those folks, you run around just trying to get anyone to pay attention or to take accountability or be responsible. And the vaccine issue is a perfect sort of microcosm and example of that, where we saw for 3 months the issue be ping-ponged back and forth on an issue of life or death. So from my perspective, they definitely have not gotten as much attention as it merited receiving, notwithstanding sort of the efforts of people inside to try to get help and advocates obviously on the outside trying to uplift the issue. And I'll say just one more thing, because I think as we campaigned on this, and I was going to say it earlier, one of the most poignant examples of what happens to this population when you try to do advocacy at the state, after we've been trying to get CVAC to respond to us for months, Governor Newsom was asked at a press conference by a reporter, what is the state's plan for immigrants in detention, or is there going to be access to the vaccine? And we had been doing advocacy for months, so presumably he should have been aware of the issue at a minimum. And what he did was he responded and began to talk about the vaccine rollout in prisons, which is fundamentally different, because CDCR and the state knew that they had to respond to that population and were responding, and people were being vaccinated. And no one, except I think in Otay Mesa, because that's also a US Marshal facility, at that time when he answered that question, no one was being vaccinated in any of the other facilities. But to answer and sort of pivot to CDCR is very disingenuous. And then what the second thing he did was to say that things were dramatically better and different 28 days later, because into Biden's administration, right? Like suddenly these facilities somehow were miraculously these, peace havens because we'd had a change in administration, when we know from being on the ground, nothing has changed, right? We just heard a gentleman died in March. He was released to die. So I think it's been a really frustrating experience for advocates, which is an aside, given obviously the horrific conditions that people inside are facing. But we do feel that the population, or I should say, I feel that the population and this issue has been short-shrifted. Yeah.
Thank you, Jackie. We have any more questions? Please, again, feel free to put them in the chat or virtually ask to, unmute yourself by raising your hand on the Zoom function. And again, for folks, this press conference is being recorded, so we will be sure to share that with you. And then if you do have any follow-up questions, any questions about materials or anything that any of our panelists talked about, please feel free to email me. My email is m and then Lee, Lee, at cpehn.org. But if there are no other questions, thank you all so much for your time today. Thank you so much for joining us. Our advocates, Dr. Rambula, thank you all so much for your time and for joining us. I think as we've shown, conditions and things were already atrocious in these facilities. The outbreak only really exacerbated those issues, and advocates and what all of our panelists are asking for are really important, not only from a public health perspective, but from just a moral and ethical perspective as well. So we look forward to hopefully working with you all. Thank you for joining us again in collaboration and in solidarity. And yeah, we'll thank you all for your time, and have a good rest of your Monday.
Thank you so much, Monica. Thank you, everyone.